Hello everyone, now let us discuss about anatomy of endocrine glands, part 4. In the current session, we will be discussing about parathyroid gland. Coming to the location, partially embedded in the posterior surface of the lateral lobes of thyroid gland are several small round masses of tissues called as parathyroid glands, and each has a mass of about 40 mg. And usually one superior and one inferior parathyroid gland are attached to each lateral thyroid lobe for a total of 4. So in total there are 4 parathyroid glands. Microscopically, the parathyroid glands contain two kinds of epithelial cells. The more numerous cells called as chief cells or principal cells, they produce parathyroid hormone or parathormone. The function of other kind of cell called as oxyphil cell is not known in a normal parathyroid gland. However, its presence clearly helps to identify the parathyroid gland histologically due to its unique staining characteristics. Furthermore, in a cancer of parathyroid glands, oxyphil cells secrete excess PTH. Coming to parathyroid hormone. The parathyroid hormone is a major regulator for the levels of calcium, magnesium and phosphate ions in the blood. Parathyroid hormone is a major regulator of levels of calcium, magnesium and phosphate ions in the blood. The specific action of parathyroid hormone is to increase the number and activity of osteoclasts. The result is elevated bone resorption, which releases ionic calcium and phosphates into the blood. The PTH also acts on kidneys. First, it slows the rate at which calcium and magnesium are lost from the blood into the urine. And second, it increases the loss of phosphate ions from blood into the urine. Because more phosphate is lost in the urine than is gained from the bones, PTH decreases the blood phosphate level and increases the blood calcium and magnesium levels. So simply put, parathyroid hormone decreases the blood phosphate levels and increases blood calcium and magnesium levels. A third effect of parathyroid hormone on kidneys is to promote the formation of hormone calcitrol, the active form of vitamin D. It promotes the formation of hormone calcitrol, the active form of vitamin D. Calcitrol, also known as 1,25-dihydrovitamin D3, increases the rate of calcium, phosphate and magnesium absorption from the gastrointestinal tract into the blood. And the parathyroid glands, normally 4 in number, are embedded in the posterior surface of the thyroid gland. Coming to the functions of parathyroid gland. Calcium is released from the bones into the bloodstream, absorption of calcium from food via the intestine, and calcium storage accomplished via the kidneys. These are the major functions of the parathyroid gland. Here you can see the 4 blue color dots are the parathyroid glands, and the pink one is the thyroid gland. And this is the histological view of parathyroid gland. And these are oxyphil cells, and these are chief cells. If you can see here, this is the portion of thyroid gland. The left side is the portion of thyroid gland and right side is the portion of parathyroid gland. In the parathyroid gland, these are the oxyphil cells and these are the chief cells. Chief cells mainly secrete the parathyroid hormone. Here also you can see these 2 dots here. This is the inferior parathyroid hormone and this is the superior parathyroid gland. Inferior parathyroid gland and superior parathyroid gland. Coming to the control of secretion of calcitonin and parathyroid hormone. The blood calcium levels directly control the secretion of both calcitonin and parathyroid hormone via negative feedback loops that do not involve the pituitary gland. A higher than normal levels of calcium ions in the blood stimulates the parafollicular cells of the thyroid gland to release more calcitonin. And this calcitonin inhibits the activity of osteoclasts, thereby decreasing the blood calcium levels. A lower than normal level of calcium in the blood stimulates chief cells of the parathyroid gland to release more parathyroid hormone. Lower than normal levels of calcium in the blood stimulate the chief cells of parathyroid gland to release more parathyroid hormone. The parathyroid hormone promotes the resorption of bone extracellular matrix, which releases the calcium into the blood and slows the loss of calcium in the urine, raising the blood calcium levels. And parathyroid hormone also stimulates the kidneys to synthesize calcitrol, the active form of vitamin D. Calcitrol is the active form of vitamin D. This calcitrol, it stimulates the increased absorption of calcium from foods in the gastrointestinal tract, which help increase the blood calcium levels. In this diagram, we will discuss the role of calcitonin, parathyroid hormone and calcitrol in the calcium homeostasis. The calcitonin is given by green arrows, whereas parathyroid hormone is indicated with blue arrows and calcitrol is indicated with orange arrows. With respect to regulation of blood calcium levels, calcitonin and PTH are the antagonists. Calcitonin and PTH are the antagonists. Coming to the first step, high levels of calcium in the blood stimulates the thyroid gland parafollicular cells to release CT, which is nothing but calcitonin. And this calcitonin inhibits the osteoclast, decreasing the blood calcium levels. Whenever high calcium levels are seen in the blood, the thyroid gland parafollicular cells release the calcitonin, which inhibits the osteoclast, decreasing the blood calcium levels. And whenever low blood calcium levels are seen in the blood, it stimulates the parathyroid gland chief cells to release more parathyroid hormone. So this parathyroid hormone, it promotes the release of calcium from the bone extracellular matrix into the blood and slows the loss of calcium in urine, increasing the blood calcium levels. And parathyroid hormone also stimulates the kidneys to release calcitrol. This calcitrol stimulates the increased absorption of calcium from food, which increases the blood level. So both parathyroid hormone and calcitrol, they increase the calcium levels in the blood. Whereas calcitonin, CT or calcitonin, it decreases the blood calcium levels. Now coming to the summary of parathyroid hormone. The parathyroid hormone is secreted from the chief cells of the parathyroid gland. These are the chief cells. They secrete parathyroid hormone. And low blood calcium levels stimulates the secretion, and high blood calcium levels, they inhibit the secretion of parathyroid hormone. Coming to the principal actions, increased blood calcium levels and magnesium. The principal action of parathyroid hormone is it increases the blood calcium and magnesium levels and decreases the blood phosphate level. Increase bone resorption by osteoclasts, increase the calcium reabsorption and phosphate excretion by kidneys, promotes the formation of calcitrol, the active form of vitamin D, which increases the rate of dietary calcium and magnesium absorption. These are the various principal actions of parathyroid hormone. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.